my name is Camila Paez, and today we'll be discussing a topic that is always present in our daily life and how we use in both unconsciously and consistently. This topic is nonverbal communication and the ways that can be used in our daily life, but we'll be focusing more in gestures and postures. But first, we need to start with the beginning. So, what is nonverbal communication? It is said that it's a process that is established inconsistently, containing non-linguistic expressions, most of the time performally inconsistently, such as our physical appearance, our tone of voice, or facial expression, or simply something really easy like our posture and our gestures. But what are gestures and postures? These two are considered nonverbal kinetic signs, which that tell us the art structures system composed of different types of kinds and kinematic compounds. In this case, kinds are minimal use or a body language, and a combination of different kinds compose the kinemic. Gestures are basic movements that we generally use consciously or unconsciously, with psychomuscular movements to produce an act of communication. This can be facial or body. For example, a smile with a wink, I consider facial expression. While the use of our hands to make an expression is considered body expression, like this. The posture, in other hands, reflects the position that our body adopts when we communicate. So, this is done unconsciously and works independent from our communication. All trials is going hand to hand with our gesture. We will always use. In my case, I want to focus more in my future career what is nursing. Raquel Ramon, Maria Segura, Maria Polenka, and Pablo Roman from the University of Almeria tell us that with the use of various gestures, family members can be calm and offer emotional support. In the study titled "Social Skills of Nursing," the paper in the communication in the family. As we can see, the use of gestures and maintain a confident posture towards the patients is very helpful in the daily routine, such as using illustrative gesture for understanding. For example, pointing the patient IV line for their family members. They also mention more complex gestures that help to explain more the procedure, like the use of the body. But we also highlight those techniques we don't learn the day to another. Ria Larson, Elizabeth Mengio, and Karen Persson in their article Interpersonal Communication in Transcultural Nursing Care in India, a discrete qualitative study, tells us that people who decide to study in the health field, specifically the nursing, must prepare for the global healthcare system. So they mentioned that the nurse receive our communication training as part of their program, where they are through verbal and non-verbal techniques to refer to their patients. Larson, Mengio, and Persson indicates to us that all the nurses use non-verbal techniques when communicating with the person. Actions and gestures were used to relay simple information or ask simple questions. And they also make us understand that a small gesture, like a simple pat on the shoulder or a simple smile, along with a confident posture are enough to a patient to feel more secure and help break down some barriers in the communication. Thus, we can see inconsistently, gesture and posture can be a message of research a patient. Many times, we don't realize that our gestures and their posture can be a lot without us knowing. It always be a complement in our daily life in our communication. Because what would it be without a simple gesture like a nod of the hand, like the affirmative or negative, or the use of our thumb up or our thumb down. In my case, my constant hands movement will while I am speaking, which I consider really an inconsistently gesture that often I do without I realize. Also, there's a simple act of showing posture which often betray us when we are nervous or confident. But it shows us that these are skills that we apply in our daily life that strain in our routines, but they are skills that we apply in work or school, and that help us to have a better development with our environment and show that small gestures like a smile can convey more than a verbal communication. So I leave you guys to think about what gestures and postures you believe you use most in your daily life and how this help us in our daily communication. Like, you think that you use more like your posture to see if you feel confidence, or use like more your gesture, like say like, oh, can you pass me that, using your finger, or simply your head, like saying yes or no. So I like you think that little stuff that we normally do like inconsistently. So thank you, and I hope you enjoy and understand my presentation about gestures and postures.